Good morning to one and all. So, today we're going to take a lecture on pre-prosthetic surgery, improving the denture bearing area. Talking about these following things, which are the learning objectives. So, by the end of the lecture, you should be able to list down objectives of pre-prosthetic surgery, relate principles of patient evaluation to pre-prosthetic surgeries, explain non-surgical management of abused tissues, list different types of pre-prosthetic surgeries, including hard and soft tissue surgeries, and relate significance of psychological and TMJ conditioning before complete denture treatment. Okay, so coming to the definition, mouth preparation is identified as those procedures that are accomplished to prepare the mouth for a reception of prosthesis. Okay, so more specifically, they are the procedures that change or modify existing oral structures of conditions to facilitate placement, removal of prosthesis, facilitate its efficient psychological function, okay, sorry, physiological function, enhance its long-term success. So, a mouth preparation follows either preliminary diagnosis and development of tentative treatment plan. All right, coming to the objectives or the importance. So, it establishes a state of health in supporting tissues. It eliminates any interference or obstructions while we are removing or placing the prosthesis in function. Also establishes an acceptable occlusal scheme and establishes an occlusal plane, acceptable occlusal plane. Also to alter natural tooth form to accommodate requirements of form and function of prosthesis. Coming to the procedure, so we are only talking the pre-prosthetic surgeries today. We are not talking about the prosthetic phase. So pre-prosthetic surgeries include removal of any hindrance in prosthetic treatment, done along with diagnosis and treatment plan to relieve any pain or infection, periodontal therapy, oral surgical preparation, conditioning of abused tissues and irritated tissues, and correction of occlusal plane. Okay. Um, so here we can do a variety of oral surgical techniques, and it can prove beneficial to clinician in preparing the patient for prosthetic replacements. Okay, so any extractions which are remaining have to be done. Removal of any residual roots, any impacted teeth, malposed teeth, any cysts and odontogenic tumors, muscle attachments and frenums, okay, any bony, spiny ridges, okay, exostoses and tori, a hyperplastic tissue. So any of these have to be either removed or treated before we proceed further for any of the further treatments. Okay, coming to extractions, so teeth with poor prognosis have to be removed. They carry no meaning, they are taking up space, and we are not able to give, the mouth a proper occlusion. Okay, so just because of that, it's better we extract the poor prognosis teeth. Okay, so non-strategic teeth that would present complications are PD design. Okay, so when these teeth are present, of course, first of all, the prosto comes at the end. So basically, these teeth cannot be present as uh, all the teeth have to be either extracted or either done an endo treatment before we start any designing or any of the further treatments. Okay, any of the further prosthodontic treatments. Okay, so that's why if they're not required, they have to be either endodontically treated or extracted, guys. Okay, coming to the residual roots. Okay, So you can see um, these few roots in the IOP and in the cast. So adjacent to abutment teeth may contribute to the progression of periodontal pockets and compromise the result from subsequent periodontal therapy. So when it's kind of creating problems, especially gum issues, and like this is infected. So when the root piece is infected, it's going to create issues in the bone and going to create problem in the healing. So such root pieces should definitely be impacted. Okay, coming to impacted teeth. So yes, there it is. Okay, impacted teeth. Okay. So all the impacted teeth, including those in edentulous areas and those adjacent to abutment teeth, should be considered for removal. Okay, the periodontal implication of impacted teeth adjacent to abutments are similar to those of retained roots. So basically, they will create pockets. They'll be deep down, and there will be problems. So that's why usually we do not retain them if not required. Coming to Malposed teeth, so poor oral hygiene and inadequate access, that's the proximal surface of crowded teeth, difficulty in establishing guiding planes, difficulty in determining a unique path of insertion. Okay, so any of these these things are created if you have malposed teeth. Okay, so that's why we always suggest at an early age orthodontic treatment should be taken place in patients who require the orthodontic treatment. Otherwise later they will have a lot of issues, especially periodontal issues. Okay, coming to the muscle attachment and freeness. So as a result of loss of bone height, muscle attachments may insert on or near the residual ridge crest. So appropriate ridge extension procedures can reposition attachments and remove bony spines, which will enhance the comfort and function of a removable partial denture. Okay, so definitely we should remove any of the bony spicules, and if required you can reposition the attachments, and it will enhance the function. Okay, so it can be done. Usually it's basically not so commonly done. Yes, it can be. Okay, coming to bony spines and knife edge ridges. So bony, sharp bony spicules, we see it very commonly in the department when edentulous patients are here with previous history of extraction with certain teeth. Should be removed and knife-like crest gently rounded. So yes, the knife edge ridge can be rounded too. Um, Usually we leave it like that and proceed further. Yeah. So exostoses and tori so cause additional stress to dentures. All right. So removal of partial denture component in proximity to this type of tissue may cause irritation and chronic ulceration. Okay. So chronic ulceration and irritation might be the most common result. Okay, coming to hyperplastic tissue. So seen in form of bulbous tuberosities, soft flabby ridges, folds, or redundant um, tissues in vestibule or floor of the mouth. So removal will produce a more stable denture, um, reduce stress and strain on supporting tissues. All right, so um, if you want a more stable denture, we better remove any of the hyperplastic tissues, okay? So, talking about an RPD or a CD. Okay, coming to conditioning of abused and irritated tissue. Okay, so um, many removal partial denture patients require some conditioning of supporting tissues in edentulous areas before the final impression phase of treatment. Okay, so patients who require conditioning treatment often demonstrate the following symptoms. Okay, inflammation and irritation of the mucosa covering the denture bearing areas, distortion of normal anatomic structures such as invasive papilla, rugae, and retromolar pads, burning sensation in residual ridge area, the tongue, the cheeks, and lips. Okay, so yes, the conditioning has to be done. Okay, I mean, yeah, these patients do require conditioning. So, yes, because of these conditions, because of these symptoms, we do require to condition the tissues. Okay, these conditions are usually associated with ill-fitting or poorly occluding removal partial denture. However, the nutritional deficiencies, endocrine imbalances, and severe health problems such as and uh, diabetes or blood dyscrastasis and bruxism must be considered in a differential diagnosis. Okay, so it can be considered, but yes, they're usually associated with ill-fitting or poorly occluding. So use of tissue conditioning materials. Okay, so tissue conditioning materials are elastopolymers that continue to flow for an extended period, permitting distorted tissues to rebound and assume its normal form. These rounded materials apparently have a massaging effect on irritated mucosa, and because their soft occlusal forces are probably more evenly distributed. Okay, so these soft tissues apparently have a massaging effect. Okay, all right, so it's because of the irritated mucosa, and we can get it done, and then yes, you can call me back. Yeah. Okay, coming to the periodontal preparation. Okay, so periodontal preparation strongly recommended that a gross debridement be replaced with okay, sorry. So yes, it is strongly recommended that a gross debridement be performed before tooth extraction when patients have significant calculus accumulations. Okay, this helps limit the possibility of accidentally dislodging a piece of calculus in the extracted socket. Okay, which could lead to an infection, guys. Yeah. Okay. Okay, sorry. So, we will definitely do this before tooth extraction when patient have significant calculus accumulation. So this helps in limiting the possibility of accidentally dislodging a piece of calculus into the extraction socket, okay, which may lead to infection, guys. So it has to be removed, okay, and the periodontal health of the remaining teeth, especially the abutment teeth. Okay, so must be evaluated carefully and the corrective measures should be taken. So abutment teeth are those teeth where we are taking a support from in cases of RPD. So maybe where we are placing the clasp or any support. Okay. All right, guys. So, coming to the last slide. So, significance of TMJ conditioning. So, I took this article I've quoted this article, so you can go through and read it. The aim of the study was to evaluate the association of edentulousness and edentulosism and removal prosthesis rehabilitation with the severity of TMD signs and symptoms. So, TMD is basically temporomuscular disorders, okay, which is seen in certain patients, and they have clicking sounds, they have pain, they have crepitus, they have a problem in moving the doing mandibular movements. So it's basically consists of many of those things. So it's okay. So what was the result? It showed that the completely edentulous individuals associated more with TMD related findings in incidence and intensity than partially or fully dentate subjects. Complete denture wearers were more associated with TMD symptoms, limited mandibular mobility, muscle tenderness, and pain on mandibular movement. Okay, signs and symptoms of TMD were more prevalent and severe in patients who needed to get their dentures repaired, those wearing dentures more than 5 years old, and in patients who had not got their dentures repaired during the past 5 years. Okay, so conclusion is edentulousness or edentulism, complete or partial denture wearing, and poor condition of the denture associated with greater incidence and intensity of TMD associated signs and symptoms. So guys, it just means that you are supposed, like when the muscle is tender, you're supposed to do conditioning of the muscle. Okay, that is known as TMG conditioning, guys. So you're supposed to relax and like do a physiotherapy. It's like a treatment. Okay, so it comes under physiotherapy. So you can, do the conditioning of the tissues or the muscles to make it relax and come back to the normal position. Okay, all right. So basically it's done, yes, to um it's done before a complete denture treatment, and if a patient has it during the complete denture or after the treatment or whenever, because of certain reasons, you can see here, these are the two reasons why a patient can have it. Okay, so if that is the case, if, you need to show the doctor, and you have to get it treated. And yes, you have to get it treated. And yes, there is also pharmacological management, so NSAIDs are given. um, Other than that, there are many managements, and one of them is the physiotherapy, which consists of conditioning. So anyway, that's what it is basically. And uh, you please understand that you really need to relate all these things to a complete danger patient or treatment, because everything has to be checked, palpated before you start a treatment, guys. So the ridge and all the TMJ joints have to be checked, palpated, and then only there will be success in the treatment. If there is muscle soreness, or you hardly called, you hardly examine the patient before doing any complete denture treatment, so then this will be a problem. So you need to know how to relate um, this, significance of psychological and TMJ conditioning before complete denture treatment. Okay, all right. So that's all, guys, for today. And thank you very much. And so basically, this is a mouth preparation topic, which can be found in any of the RPD textbooks. RPD textbooks are the standard ones are McCracken and Stewart's. Okay, so these two are the authors' names, guys. Okay, so any of the two can be referred to. You can refer to articles online, and for any further problems or issues or something you don't understand, please see me in Polyclinic 3 in the Prosto department. I'm always there. So if you have any questions, guys, feel free to come and ask me. But definitely go through the topic, and let me know if there is something in which I can be helpful with. Okay, so refer to these textbooks, refer to articles, and you can come and ask questions if you like. Thank you for patient listening, guys.